My name is Dr. Jared Hendershot, and I'm going to touch on pregnancy adjusting or perinatal adjusting here at Pearson Weary Chiropractic. So there's a lot of benefits of getting chiropractic care while pregnant, whether that's in the first, second, or even third trimester of pregnancy. The body's under a lot of different stress during pregnancy. Obviously, there's a little added weight. The muscles are working a little bit harder, but also the ligaments and the soft tissues in the body change as well. So making sure that the pelvis is moving correctly, making sure all of the hard tissues, the joints, the skeletal system is moving correctly is vital in making sure that the pregnancy is moving as it should and everything's functioning as it should. Obviously, there's low back pain and other pain, maybe pelvic pain that can be occurring during pregnancy, especially during the later stages. Safety is always of great importance to us as chiropractors, and especially in pregnant mamas as well. So yes, chiropractic care is very safe, especially during pregnancy in those that have been trained to treat pregnant patients. We're going to make sure that you're comfortable, that everything is pain-free, and that everything is safe that we do as well. There's a lot of different techniques in chiropractic care. One of them is called Webster technique, in which I've been able to be certified and employ that technique with patients that come in that are pregnant. So Webster technique is the chiropractic standard for treating pregnant patients. Its main focus is working on the pelvis to make sure that all of the joints in the pelvis are working in a healthy and optimal fashion in preparation for labor, so that the body's able to work optimally and have a smooth, effective labor and delivery. So having 4 kids myself and watching my wife go through her 4 pregnancies, there's definitely a lot of things that happen in the human body during pregnancy. So the ligaments change, the muscles change. Obviously, there's physical changes that are going on. But even before and after pregnancy, even after pregnancy, holding baby quite a bit and using those arm muscles and shoulder muscles throughout that process. There's a lot of physiological changes that go on. And as far as the musculoskeletal system, a lot of that should be addressed. Low back pain is obviously very common. Achy, swelling feet, very, very common in pregnancy, as well as upper back pain and neck pain. All of those things should be addressed because we want to make the body working as effectively as possible. We want that pelvis to be moving as effectively as possible in preparations to labor and birth. A lot of pregnant patients that come in kind of want to know what a good schedule or routine is when they come in. Generally, that's dependent on every patient individually. Usually in the first or second trimesters, they'll come in once every 2 weeks or periodically check in. But third trimester, generally, the patients will come a little bit more frequently as, for obvious reasons, baby growing a little bit larger, more weight in the hips and pressure in the pelvis. But also, we want to make sure that pelvis is functioning optimally, especially in the third trimesters. Every birth looks a little bit different. Every journey is a little bit different. We have patients that maybe have a breech baby, or they know they're going in for C-section. All of the treatment that we render is definitely beneficial, regardless of what the outcome of labor is or the method of labor is. Because we're working with those joints and those muscles, and all of that plays a role in labor, regardless if it's a C-section or if it's a normal delivery. But all throughout the term of pregnancy, it's very important to get those muscles worked on, get the joints worked on, so that everything can work optimally. So if you're looking for a safe and effective pregnancy, labor, delivery, I would encourage you to go to Pearson Weary Chiropractic, and especially with me, Dr. Hendershot, to employ the Webster technique and to work with you and to make sure that pregnancy is as pain-free and effective as possible.